Canada has been grappling with a severe and escalating drug crisis, particularly concerning fentanyl and other potent street opioids, which have tragically claimed thousands of lives across the country. This public health emergency has placed immense pressure on communities, healthcare systems, and law enforcement, fundamentally challenging the nation's social fabric. In response, various levels of Canadian government have implemented policies largely centered on a harm reduction approach, aiming to prevent overdose deaths and reduce the spread of diseases associated with drug use. However, these policies have become a focal point of intense controversy, with many critics arguing they have been detrimental to Canada's social well-being rather than providing effective solutions. A cornerstone of the government's strategy has been the establishment of supervised consumption sites (SCS) and the introduction of safe supply programs, where prescribed opioids are provided to individuals with substance use disorders. While proponents argue these initiatives save lives by preventing overdoses and connecting users with services, opponents contend that the implementation and management of these programs have been deeply flawed. Concerns have been raised about the diversion of safe supply drugs onto the black market, inadvertently fueling the illicit drug trade and making potent substances more accessible to new users, including youth. This perceived lack of control over prescribed drugs has led to accusations of poor policy design and oversight. Furthermore, critics argue that the heavy emphasis on harm reduction has come at the expense of robust investment in and access to long-term treatment and recovery options. Many communities and families affected by addiction express frustration that policies seem to prioritize managing drug use rather than helping individuals achieve sobriety and reintegrate into society. This imbalance, they contend, has created a revolving door of addiction, where individuals are kept alive but not necessarily supported in breaking free from drug dependency. The social well-being of Canadian communities has also been significantly impacted by these drug policies. Areas surrounding supervised consumption sites have often reported increased public drug use, discarded needles, and a rise in petty crime, leading to feelings of insecurity and frustration among residents and businesses. This visible manifestation of the drug crisis, coupled with the ongoing high death toll, has fueled a sense that the government's approach is not effectively containing the problem but rather allowing it to proliferate in public spaces. The controversy highlights a deep divide in how to best address the complex challenges of addiction, with many Canadians questioning the efficacy and long-term societal impact of current government strategies,